Hello everyone. This Med this week is focused on food insecurity in the Middle East and North African countries. Since the outbreak of the war in Ukraine, food security in the region has been a major concern for policymakers, international organizations and observers of Middle East and North African affairs. This is due to the high dependence of many countries on food imports from both Russia and Ukraine, to the risk of disruptions in food trade, and to the impact of higher prices on national budgets and public finances. There have been fears that high inflation could result in rallies, political demonstrations, popular discontent, and, generally speaking, instability. Today, food inflation is easing, but prices are still elevated. Against this backdrop, the problem of food insecurity in the region is not limited to food prices. It is much more complicated and dates back to decades. The issue intertwines with several political and economic dimensions, from the sustainability of the social contract to the resilience of agricultural systems to the more and more evident effects of climate change. For this Med this week, we have the pleasure to host Roberta Gatti, Chief Economist of the Middle East and North Africa at the World Bank. Roberta, thanks for being here. One of the latest World Bank reports analyzes the long-term effects of rising food prices and food insecurity in the MENA region, stressing that high food prices alter the destinies of the people of the region, causing intergenerational consequences and irreversible damages. In which ways exactly food insecurity impacts the future of the societies of the region?
Thank you, Aldo, and thank you, ISPI, for having me here. The idea that we explore in this report is that food price inflation, even if it is a temporary shock, can really alter destinies in a long-term way. And so there is a considerable literature that looks at the impact of temporary shocks on children. And essentially, there are two streams of this literature. The first one is the fetal origin hypothesis that postulates that conditions such as inadequate nutrition during pregnancy really affect the health of the fetus, and then has repercussions for the health of a child, and it has repercussions well into adulthood with higher rates of cardiovascular diseases, diabetes, and obesity. The second related strand of literature looks at the first 1,000 days of life. And there's a lot being written in the medical and also in the economics literature that shows that these 1,000 days of life are fundamental for the development of adults and for human capital accumulation. And so if nutrition falls short of what is necessary in those 1,000 days, the damages can be important and have repercussions in terms of productivities later on in life. And this is also the hypothesis and the basis behind something that I worked on earlier in my career, which is called the Human Capital Index, which is a measure that summarizes the human capital that a child is expected to accumulate up to age 18, given the risk to health and schooling in her country. And this is based exactly on this idea. And for those who are interested in this literature, there are very interesting papers written by Doug Almond and Janet Curry that really summarize well these channels. Of course, it all depends on the shock. And the shock can be a large shock, such as a famine, or can be a smaller shock, such as a temporary increase in food prices, as what we hope we are seeing in the Middle East and North Africa.
And are all the countries of the region affected in the same way, or there are differences in terms, for example, of sub-regions or different geographic areas?
Well, the Middle East and North Africa region is very heterogeneous, so you should expect differences that depends on many factors. First, on how high food inflation has been. Second, on how the government has handled it. But third, also on the initial state of child health. And let me focus on this last one specifically. So think about some of the fragile countries that we have in the region: Yemen, Libya, Syria. In these countries, already in 2013, which is about 10 years ago, anywhere between 1 in 2 to 1 in 3 children were already stunted. What is stunting? Stunting is height for age, and it's a relatively easy measure to collect, and it's a sort of summary measure of the health insults that children have had up to age 2 or up to age 5. So with an already pre-existing difficult situation in terms of stunting and malnutrition in some countries, the fragile ones, and also higher rate of obesity, what is called the double burden of disease, which is very typical of middle-income countries. The MENA region is not starting on a strong footing. Something that I wanted to highlight is that I spoke about data that are 10 years old. And in this recent report, we show that we have data that are not more than 7 years old, only for 11 out of the 19 countries in the region. So not only how these impacts unfold will depend on the different conditions, but we don't even know exactly what is going on in terms of child nutrition and health in a large number of our countries. Now, this was kind of like looking backwards to the status quo as of today or as of 10 years ago, depending on when we have the data. But if we want to look forward, what we have done was to use data from the FAO, complemented with machine learning, and we have estimated the forecast number of children who are going to be food insecure. And up to 8 million children in the developing part of the MENA region will be food insecure, with more than 2/3 of them concentrated in Syria and Yemen. So definitely the variation on the existing conditions of the country have a big impact on what we can expect.
Thank you. Thank you, Roberta. And in what ways can the countries of the region try to mitigate food inflation and tackle food insecurity? I mean, how can they make food systems more resilient, improve the agricultural sector and the local productivity, and strengthen food supply chains?
Look, there are many ways in which food systems can be improved. Think about the importance of investing in innovation, think about trade facilitation. But the reality is that food prices depend on global food prices, and we can think about the economies in the MENA region as small open economies, so they are unlikely to really make a dent in these food prices. Now, it's probably going to have a more immediate impact to focus on policies that protect children and families from these shocks in the short term. So the first one is to use and expand cash transfers to protect the most vulnerable. And something that we really need to be aware of is that inflation is a regressive shock, is a shock that impacts vulnerable families the most. And so it's important to protect them from these shocks, particularly when the component of food is very large. The second one, if we think about this fetal origin hypothesis of one of the channels of transmission, is to protect mothers and make sure that the nutrition of mothers and the nutrition of children is taken care of. How do you do that? You will need to have high coverage of health systems so that mothers also have access to good care during pregnancy, and children do the same. I was talking about data earlier, and I cannot but conclude on the importance of improving measurement. Collecting more and better data is something in which the MENA region should really invest. Importantly, for anthropometrics, which really means to be able to measure what is going on in the development of children, but also for the broader data ecosystem of the region.
Last question for you. Intervening on food systems is quite a sensitive issue in the MENA region. For example, the food subsidy system is a significant constituent of the social contract and an essential tool for social protection. So how can the countries of the region reform the food subsidy system without fueling popular protests and demonstrations?
So, Aldo, you're asking me a very difficult question here, but reforming food systems is one of the ways in which inefficiencies and distortions can be reduced. Also, what can be reduced are fiscal costs. And in a previous report, one of our economic updates, that one is called A New State of Mind, we had a couple of simulations to try to compare how much it would cost to have a general subsidy to compensate for food and fuel. At that time, we were looking at both fuel and food prices to compensate the general population vis-a-vis getting targeted cash transfers. So just to give you a sense, if you were to compensate the poorest 10% of the population only for the equivalent food and fuel shock that happened in Egypt, if you use general subsidies, you would have fiscal costs that are about 13 times higher than targeted cash transfers that go to the bottom 10% of the population. Now, why the bottom 10%? Because we know that the vulnerable are the most affected. If we want to compensate the poorest 60% of the population, of course, those numbers go down. But on average, we looked at the cost of a general subsidy can be up to twice as high of the one of cash transfers that are targeted to 60% of the population. So there are many gains from rethinking the subsidy system and reforming it to avoid distortions in prices and to avoid this very high fiscal cost, which are particularly concerning because most of our oil importing economies have very limited fiscal space and already high sovereign debt.
Thank you very much, Roberta Gatti, Chief Economist at the World Bank.
Thank you, Aldo. It was a pleasure.
For me too.